Thank you very much, sir. Good evening. Our topic is antifungal sensitivity profile of Fusarium species resulting in keratitis. This is the outline of my presentation. A brief introduction. Fungal keratitis is an important cause of visual impairment and blindness. There is gradual increase in incidence of fungal keratitis over the past few years due to many reasons like increased use of contact lenses, application of broad-spectrum antibiotics and so on. It can be complicated with serious events like perforation, endophthalmitis and blindness. Diversity of fungi are responsible for fungal keratitis. For example, Candida species, Aspergillus species, Acremonium species, like that. And genus Fusarium, which is a hyaline mold, is a leading cause for fungal keratitis worldwide. It has higher degree of resistance to antifungal agent, giving a therapy reactive nature. So it's a continuous therapeutic challenge to ophthalmologists. So our objectives were to identify Fusarium species, Fusarium isolates from corneal specimens received at Medical Research Institute from 2013 to 2016 up to species level, and to determine antifungal susceptibility pattern of them. Our methodology: all Fusarium isolates obtained from specimens of patients with keratitis received at the Department of Mycology from January 2013 to March 2016 were included in the study. All isolates stored at -80 centigrade refrigerator were subcultured on potatoes, dextrose, agar. We did phenotypic identification using macroscopic features and microscopic features of this species. Pure cultures of isolates were maintained on PDA agar, and plates were incubated for 2 weeks at 26 centigrades, and the morphological identification was done using color of the colony, consistency of the colonies, and surface and growth rates of the colonies. For microscopic identification, those cultures were examined using lactophenol cotton blue, and slide cultures were done for all isolates. We used sporulation patterns and the characters of chlamydospores for the identification. All those morphological characters were confirmed by comparing them with the characters given in the Atlas of Clinical Fungi. Isolates were grown on potato, dextrose, agar. We did antifungal sensitivity according to CLSI M51A distribution method. Those isolates were grown on PDA plates and incubated to induce sporulation. Then spore suspension was made with 0.9% sterile normal saline, and final inoculum was adjusted to density of 1 to 5, 10 to the power 4 spores per ml, and inoculated on non-supplemented Muller-Hinton agar plates. We inoculated amphotericin B, itraconazole and voriconazole on that place. Those plates were incubated at 37 for 72 to 96 hours. Then we measured the zone diameter given and compared them with the tentative zone diameter cutoff values given at M51 informational supplement. According to that supplement, emergence of reduced susceptibility to antifungal is considered when inhibitory zone sizes less than given values. Quality control was done with Candida cruzi ATCC 62258 strain, and ethical clearance was obtained through ethics review committee at MRI, and finally result were analyzed using SPSS software. Let's move to the results. Altogether 51 Fusarium isolates were subcultured from the stock culture. 5 isolates were contaminated and excluded from the study. We got FIO growth of 46. This slide shows the morphologic characteristic of the colony. You can see different colors and consistency of obverse and reverse views of the isolates. This slide shows the microscopic patterns of chlamydospores and spores in the main isolates. According to those features, we identify majority as Fusarium solani complex, 52%. It was followed by Fusarium chlamydosporum complex, 33%, Fusarium dimerum, 4%, Fusarium nigraminum, 2%, and Polyphoratum, 2%. 3 species were unable to speciate 3 isolates were unable to speciate according to that. Then we compared the tentative zone diameters and the inhibitory zones given in the supplement. The summary is given in this table. We will discuss about it in detail. Green color indicate the isolates with inhibitory zone sizes more than cutoff value. Red indicate the isolates with tentative zone diameters less than cutoff values. Here among the all isolates, majority of Fusarium isolates had inhibitory zone sizes more than tentative zone diameter cutoff values for voriconazole, but significant number of Fusarium isolates had inhibitory zone diameter less than that for itraconazole and amphotericin B. So 70% of isolates had lower zone diameters compared with tentative zone diameter cutoff values for amphotericin B, indicating the presence of isolates with acquired resistance to amphotericin B. Similar to that, 93% of isolates had lesser zone diameters compared to itraconazole, again indicating the presence of isolates with acquired resistance. But for voriconazole, only 2% had lesser zone diameters. Let's move to the antifungal sensitive pattern for itraconazole at the species level. According to these slides, we can see all Fusarium complexes, majority of Chlamydosporum and all Dimerum had inhibitory zone sizes less than epidemiological cutoff values that indicated the presence of isolates with acquired resistance among Fusarium solani, Fusarium Chlamydosporum, Dimerum and Polyphoratum. This is for amphotericin B. Again, majority of Fusarium solani complex, Polyphoratum and Chlamydosporum had lower inhibitory zone sizes, again indicating the presence of isolates with acquired resistance among those species for amphotericin B. But for voriconazole, it was different. Almost all Fusarium species had larger inhibitory zones compared with cutoff values, except one Fusarium solani complex. Let's move to the discussion. All Fusarium complex was the most frequent isolate in our study. Most of the similar studies have found that Fusarium solani complex as the most frequent clinical isolate. However, the distribution of species in current studies is different from other studies. According to Toronto et al., he got Fusarium solani followed by Fusarium oxysporum, Fusarium verticularis and Fusarium moniliforme. But according to Kessler et al., he got Fusarium solani complex followed by Fusarium oxysporum, Fusarium dimerum and incartum. This may represent the species variation according to different geographical location. 3 isolates were difficult to speciate morphologically. The morphological classification of Fusarium isolates to species level is reported inconsistent in other studies too. 70% of all Fusarium isolates had lower zone diameters than cutoff values for amphotericin B, and 93% had lower zone diameters compared with itraconazole, indicating the presence of isolates with acquired resistance to both drugs. In contrast to that, illustrator who did microbe dilution method found that amphotericin B as the only drug that showed activity against all Fusarium species. But he also found that no in vitro activity of itraconazole and posaconazole against Fusarium. In our study, 98% of Fusarium had zone diameters more than tentative zone diameter for voriconazole, indicate the lack of isolates with acquired resistance at the moment. There are similar studies for that thing also. Fusarium solani complex had lower inhibitory zone sizes for itraconazole and amphotericin B compared with the cutoff values provided at distribution method. This may indicate the emergence of resistant strains frequently among Fusarium solani complex. Actually, Fusarium solani is a more resistant type of Fusarium species. Conclusion. Majority of our isolates belong to Fusarium solani complex, which was the most common and resistant type of Fusarium species. Morphological identification cannot be used as the only method for speciation of Fusarium isolates, so we require other methods like molecular methods. Different Fusarium species show different antifungal sensitive profile, so identification up to the species level can aid in the choice of appropriate antifungal therapy. And emergence of resistant strains through Fusarium clinical isolate is not uncommon for commonly used antifungal agents. So we should do antifungal sensitivity pattern for them. These are my references. And thank you.